One of my most important jobs is recruiting excellent therapists to join our team. So I put a lot of thought into what are the essential ingredients that make up a good therapist apart from training in their particular specialty. So if you're watching this video, you might be considering trying therapy for the first time, or maybe gathering some information, or trying to get the courage up to try again after a less than great experience the first go round. So I want to empower you, and I recommend that whoever you speak with have these 4 qualities. First, they need to be deep thinkers. And I know this can be hard to assess in a phone call or maybe a first meeting, but when you ask them about their approach to therapy, they should have an answer. You need to get a sense that they've been well trained, they know theory, they think as social scientists. And whatever recommendation or feedback or formulation they're going to give you, and as they're thinking about the targets for intervention in your work, you're going to know that it's way more than just a personal opinion, right? They're drawing from the incredible knowledge base we have about what makes up good mental health care. Second, they need to love being therapists. They need to be passionate about doing the work of therapy. No burned out therapist. You don't want to work with someone who you don't feel like they are energetically present with you. We know that a positive therapy relationship, a strong therapy alliance, is an essential ingredient for really facilitating the process of change and healing, no matter what the focus is of the particular treatment. Third, they need to be able to give you confidence and that they have the skills, right? That empirically validated skills to help you get unstuck and resolve your problem or dilemma. One of the most common complaints or concerns I get when people call into our practice is that they've had a perfectly fine, maybe mediocre or not bad experience before, but they didn't feel like anything really happened, right? They still felt stuck. So in addition to knowledge, connection, they need to bring practical skills to help you really practice and have a way to work through your problem and have a sense of agency and competency toward reaching your goal. Lastly, your therapist should really leave you with the sense that they care about you. Yes, it's a professional relationship. And sometimes people say, well, I pay for it. They don't really care. But in fact, any good therapist actually cares a great deal about their clients and is really invested in the process of helping them change. The professional relationship is an essential boundary. I think of it as like a little garden, a little atrium, but one of the essential kind of water nutrients for the process of change is this sense that you really can tell that your therapist is invested in your healing and your recovery. So I wish you the very, very best in your process of finding the ideal match for you. Do not settle for less. You should leave that first appointment really feeling like, yep, I think we can get somewhere here together.